Hello everyone, my name is Lauren Harris and I am a student at Charleston University of Medicine and Science, and I will be presenting today on my research project titled Adherence and Retention of African Americans Living with HIV. As we may know, HIV has been an epidemic since 1981 and has been disproportionately affecting African Americans. 1 in 6 African American men who have sex with men are at risk of contracting HIV. 1 in 20 African American men are at higher risk of contracting HIV, and 1 in 48 African American women are at risk of contracting HIV. Black women in the United States are disproportionately affected by HIV infection, accounting for 58% of new infections compared to their white counterparts at 21% and their Latina counterparts at 17%, which contributes to their overall disease prevalence and HIV mortality. Trans women of color are at a higher risk, as one global study estimated that trans women are 49 times more likely to be diagnosed with HIV infection than the general population. People of color infected with HIV are less likely to be engaged and retained in care than white people with HIV infection, increasing the rates of morbidity and mortality. Our study is a 6-month evidence-based clinical intervention supported by the California Department of Public Health, which utilizes enhanced patient navigation services to address barriers causing disparities in HIV care among African Americans who have fallen out of clinical care at a South Los Angeles clinic. The objectives are to offer personalized support through patient navigators, increased health literacy, identifying barriers affecting social determinants of health, and achieving viral load suppression. Our preliminary study is originally designed to enroll 100 participants. We currently have identified and enrolled 82 participants into the study. All of our participants are 18 years or older. They are receiving their HIV primary care at MLK OASIS Clinic. They have all fallen out of care, but they are not virally suppressed. Some of our subpopulations include bisexual, men who have sex with men, gay, transgender women, cisgender women, and or individuals who inject drugs. The intervention was led by culturally competent patient navigators who come from the community they serve. Patients met with navigators on an individualized basis to address barriers to care and adherence to antiretroviral medications, as well as to obtain stigma and discrimination surveys. In order to assess the effectiveness of the study, we will compare our participant baseline surveys to our 3- and 6-month follow-up surveys. All encounter forms and surveys were entered into a secure database known as REDCap. So here we have our baseline demographics of our study population. The average age of a participant was 44 years old. 73% of our participants identified as male, 24% of our participants identified as female, and 3% of our participants identified as trans female or trans women. All of our participants identified as being Black or African American. Some of the identified barriers or unmet needs were financial instability at 64%, unstable housing at 46%, lack of transportation at 40%, illicit alcohol use at 39%, and cocaine use at 16%. Of the patients who identified with financial instability, 29.6% of them identified this as being a monthly occurrence. Places of residence for patients who identified with having unstable housing identified their current homes to be transitional homes, someone else's home, treatment programs, their cars, the street, or even a park bench. 30.5% of patients who reported substance use expressed a need and assistance in getting treatment. Our hopes are to address the indicated barriers to health as well as others, and to obtain a 90% success rate in linkage of care, a 90% success rate in adherence and ARV treatment, and a 90% success rate of viral load suppression. With our anticipated success in linking, retaining, and adhering patients to HIV care and ARV treatment, we are hoping to be able to highlight the impact that barriers and unmet needs have on the rate of HIV transmission and management. It is to no surprise that African Americans living with HIV are victims of systematic oppression in the ways of financial, food, and residential insecurities and beyond. Living in America as an African American is hard enough, and the day-to-day struggles make it hard to prioritize adherence to HIV care. In the event that we have our expected results, we will recommend that clinics and healthcare centers increase enhanced patient navigation services via culturally competent patient navigators to help achieve viral load suppression in this marginalized population. It is important that we prioritize bridging gaps between African Americans and HIV care in America, specifically in South Los Angeles. Thank you so much and have a wonderful day.